Hello and welcome to Monash Connections for Change. Today it gives me great pleasure to introduce Dr. Luke Rodda. Luke is the Chief Forensic Toxicologist and Lab Director for the Office of the Chief Medical Examiner in San Francisco. He sits on our Global Leaders Network Advisory Committee in the San Francisco Bay Area and was formerly an adjunct professor in the Faculty of Medicine, Nursing and Health Sciences at Monash University. I also want to thank the Monash alumni community for their questions about forensic medicine, adaptability, management, and leadership in crisis. Luke, thank you for joining us today. Why don't you start by telling us what the last few months has been like for you in watching the pandemic unfold in San Francisco?
Yeah, thank you, John, for the invitation. And it's been different. Of course, it's been a huge change for the whole world. What we've experienced here in San Francisco and at the Office of the Chief Medical Examiner has been what people expect, which has been a huge change in operations, in how we look at our work, think about approaches and try to come up with solutions to this. Operationally, we have to maintain our work just through the nature of what we do. And so we really have been challenged by this whole process.
And Luke, alumni are very interested in sort of adaptability, teams and organisations' ability to pivot. So can you tell us a little bit about how you've had to pivot the focus of your team in response to the immediate crisis?
Yeah, so we have, of course, decedent investigations, death investigations. We have a range of people in our whole department who look at collection of bodies. They go to the scene and investigate. We have forensic pathologists who perform the autopsies. We also have laboratory staff, and that's really who I oversee, which is the forensic laboratory division. Now, a lot of our work is forensic toxicology, looking at drugs, alcohol, and poisons in deaths, and also other forensic casework in the city. Now, we've looked at how we can maintain that operation, and where we've pivoted is to also offer our services to the death investigators. So should we happen to have an increase in caseload over this past time or in the future, we're ready to adapt and to help out with as need be. But also, within the group, we've had to change how we operate. We've looked at spatial awareness in our office spaces. We've been wearing, masks and PPE even around the office areas now for over a month. We're fortunate here to have a new facility, which really allows us to have that spatial distancing between us all, but it's still something we want to be conscious about. So we're wiping down offices and meeting spaces after every meeting. I have my mask off now, but typically it goes around everywhere I go, and we hold conversations with masks and with spatial distancing too, which has had its challenges. For court cases and for outside meetings, we've adapted to, like many people, video conferencing. So we've all had to learn quite quickly how to operate, Zoom and other software to get us functional in that way.
And can you tell us a little bit about your engagement with your broad range of stakeholders over this time, be they employees, patients, families, governments, etc.?
Yeah, I mean, like I said before, we really have to maintain that, and we are an essential function for the community, and so we haven't had any days off. We've continued on as we have prior to this pandemic and shelter in place. We have, of course, informed any external stakeholders, the law enforcement, attorneys, and we've communicated to them that communications are only going to happen over either phone or video conferences. So we've done those what could be expected mainstream type approaches to deal with those communications, but we still have physical contact with the community through scene investigations, and so others in our department have still maintained PPE exposure to the outside world, so to speak. but looking at a whole lot of safety measures as we've incorporated these things.
And Luke, what are some of the key findings emanating out of your office that can inform us beyond the immediate crisis?
Yeah, I mean, there's obviously things we learn in terms of the forensic nature that we do, the cases that we see. We're very fortunate that we've had some very quick leadership decisions made early by our government and our leadership. One of the first cities to enact shelter in place, and that's really helped to reduce the spread of the pandemic. And although we have been geared up for whatever might happen in terms of caseload here, fortunately we haven't yet seen that transpire, which has been a really successful story, I think, at least in San Francisco and the Bay Area, and also in other parts of California. So there's those learnings that we've learned through the forensic casework. In terms of leadership and management, I've learned a lot about how important it is to have a really good culture in the group. It's something that we've already focused on for many years now, is how we communicate with each other, how we operate, and what culture we bring to this office. And I think that's put us in really good stead for the current position we're in. The staff have been fantastic and completely willing to not only just be present and come into work during these testing and hard and stressful times, but also to be thinking innovatively, to think about how they can be part of the solution, and just be there for each other. I think that it's been an amazing thing to watch, and really, I think, I don't know if I say learn, because I kind of really felt it from our group, but reaffirms what our group has been about, I think.
Yeah, great. And just to close, Luke, over the course of shelter in place, what have you learned either about yourself, your team, your wife? What sort of something that's sort of come out of this that's been a real takeaway for you?
Yeah, I mean, explained before about what I learned from my team is obviously a huge point in terms of operationally and for our workplace. On a personal note, I think, going home every day is it's tough. I mean, I'm fortunate to be able to come to work, I think, and operate in a working environment. But for people who are at home, it can be very challenging. And people who are stuck inside, there is some sense of being able to get outside the house and even just driving to and from work. So I think learning that to be there for each other when you do come home, and I'm lucky I have a very supportive wife, but to also think about people who don't have family. How are they coping, going to home and staying home either by themselves, or sometimes, at least if they go into work, they have that ability to communicate with others in the outside world. And so I think it's important that we be there as not just a workplace and as colleagues, but also as part of the greater community to each other, which, I think you look at parts of the world and what people are, how they're treating each other has been fantastic. And so, I think that's something that I've definitely learned personally that is important to us and definitely to my family.
Yeah, fantastic. Well, that's a great place to leave this conversation, Luke. Thank you again, Luke, Dr. Rodda, for your time today, and thank you to our Monash alumni community for submitting these questions.